what's up guys? Here we are again with another video, and it's been a while since I've done another one for this channel. So the topic that we're going to be discussing today would be about fibromyalgia. Okay, so what is fibromyalgia? So fibromyalgia is a chronic syndrome of unknown origin that causes pain in the muscles, bones, or joints. That means that it occurs for a long time, and generally a person that has this has pain that they can feel usually by their necks, by their joints, by their lower back, and overall pain basically. This disorder is characterized by widespread musculoskeletal pain, accompanied by sleeplessness, poor memory, a lot of fatigue, like really excessive fatigue, and mood problems. So, getting more into detail for the patho of this disorder. Fibromyalgia, as I mentioned earlier, is a musculoskeletal disorder that causes those that have that to have amplified painful sensations of the muscles and bones with no specific triggering event. Meaning, it can be due to excessive exercise, maybe just like bad sleep, stress. There's a lot of things that can actually trigger this, and then that's why they have so much pain. A lot of researchers believe that this disease affects the brain and the spinal cords process of intercepting or interpreting the pain signals, meaning it can really amplify it to a certain degree, or sometimes not at all, to like a certain dull level of pain. Now, this disorder already affects around 5 million people, and honestly, about 80 to 90% of them are basically women. So women in general are the ones that are more susceptible for this kind of disorder. So some risk factors include like your medical history. If you happen to have anybody in your family that has that, there's a large chance that you will probably be diagnosed with this as well. And another one that would be in danger or at risk for this is those people with other MS, like musculoskeletal disorders like osteoarthritis, rheumatoid arthritis, and lupus. Now, there is no known cure for this, and for now, medical and physical treatments are the only things that you can do for managing this disorder. So I feel bad for most of the women over here, but it's again, it's a certain disorder that affects mostly the women in general, and some of the symptoms and the manifestations on this, which I will explain later, are really tied up towards the female gene. Okay, so what are some of the clinical manifestations of this disorder? Now, as I mentioned earlier, one of these would be joint and muscle pains. This can be one or the other, and sometimes it actually occurs for both. The most common points for pain would be around the neck area, the lower back, the elbows, and the knees. Another symptom for this could actually be TMJ, or temporomandibular jaw. I believe that's the pain that occurs in the jaws. Another manifestation would be a couple of CNS issues, or your central nervous system problems, and this would occur, or rather, this would rather be headaches, for example. Anybody that has fibromyalgia will always have constant headaches with that. Sleep disorders, they're unable to sleep. There's some cognitive and memory impairments where they have problems remembering stuff, forgetting things, And again, there's also anxiety and depression that occurs because of this. Because of that chronic pain that they have, they develop that kind of like mood alterations and mood issues. And one of this that actually gets to them is constant fatigue. That's another symptom of this disorder, because of not getting enough sleep, always getting tired easily. It just triggers it out, and it just amplifies the pain throughout the body. Another specific one that occurs because of like I presented earlier, because of this occurs mostly for, again, women, the PMS, the premenstrual tension that they get is very painful. They experience very, very, very painful dysmenorrhea. Not like, I mean, I'm a man. I don't not understand, but I don't know what the pain feels like. But based on my research, people with fibromyalgia get about 2 or 3 times the value of the pain from their menses, from during the PMS. Another problem that the women usually also have with fibromyalgia would be the interstitial cystitis. Basically, that's pain during urination. I believe it's because of the pressure of the bladder, that's where they feel that pain over there. And again, it's debilitating because it affects the whole body in general, right? So how is this condition diagnosed? Now, there's no specific test that can actually be done in order for one to be diagnosed with fibromyalgia. Now, there are a couple of things that they can do in order for you to get diagnosed, though. And because of these tests, because of all these things, the diagnosis on this may take months, even years, because the signs and the symptoms of everything for this disorder are pretty much general for the other musculoskeletal disorders, right? So the important thing there is collecting that subjective data from the patient, or for the person that could probably be suffering from this. This data would include like information about pain, about their muscle pain, their joint pain, their jaw pain, if they're undergoing any fatigue, any cognitive issues, that sort of thing. Now, the objective data that we could try to get from this would be the region of the pain. Now, based on my research, what they're doing now is they're trying to understand which area of the body are you feeling most of the pain. Is it the left upper, right upper, left lower, right upper, or the actual region? It has to go through, like if it's part of the, let's say that it's on your right upper, it has to be a part of the neck, pain in this general area, on your shoulders, on your elbows, on your arms, kind of like tennis. It has to be like a chronic pain, meaning that it's there for a long time. Now, there are also some actual medical tests that you can do to eliminate other conditions or other possibilities of other disorders, and some of these tests are the CBC, or the complete blood count, the rheumatoid factor, and then there's the erythrocyte sedimentation rate, or the ESR. Now, these are just some of those tests that, again, the MD or the doctor or physician will have to go through and assess and collate and at least try to build it up in order for a person to be diagnosed with fibromyalgia. Okay, so now we're going to look into treatments for this disorder. Now, as I said earlier, there is no actual known direct cure, medically or physically, for this condition. So what they try to do is they try to blend both medical and physical treatments in order to manage this chronic disorder. Some pharmacological treatments include some pain relievers, kind of like acetaminophen, ibuprofen, and naproxen to actually help dull and alleviate the pain that can help manage the pain. There's some antidepressants like duloxetine and milnacipran that may ease the fatigue and the depression for the patient. And lastly, there are anti-seizure drugs like pregabalin and gabapentin. Not sure if I'm pronouncing it right. That basically reduces the spasms that happens on your legs and your arms and your joints. That basically leads to a lesser fatigue and better sleep. Now, there are also other physical treatments that they can do for people or patients suffering from fibromyalgia, and these include like physical therapy, where the therapist tries to improve the strength, the stamina, and the flexibility of the person in order to basically get the body used to that kind of chronic pain, right? And the occupational therapist could actually adjust some of the ADLs of the person, in which the activities are going to be less stressful for the body. If they're getting like a lot of lower back pain, a lot of like shoulder pain, a lot of neck pain, the OT is going to give out some exercises, some tips on, again, like tying your shoes or basically getting out of bed, that kind of thing. Okay, so now to address the last question that we have about about this disorder. What interventions can we do as healthcare professionals, right? Now that we know that this condition is a chronic condition, what we need to establish for the person is basically education. Education is the main thing for a person that has fibromyalgia, trying to let them understand what the signs and symptoms are, what could possibly trigger it, what's going to happen, what the prognosis is going to be, and that sort of thing. One of these things that we can teach patients would be good sleep hygiene. This is teaching the patient about having good sleeping habits, having to have a sleep routine to basically fight the fatigue, because they're going to get fatigued throughout this condition, and it's just going to get worse. Now, sleep is the best way for you to like fight that, and if they get good sleep and at least they'll rest their body. Again, there's also going to be medications that they need to take as well to help promote that good sleep hygiene. Next would be regular exercise. Just with any kind of condition, exercise is always a good thing. It allows the body to build up the stamina and the strength that we need in order for us to, fight this condition, like to have a better build for this condition. Now, there's some like really good non-impact exercises like swimming, walking, and stationary biking that are not too hard on the knees and the joints and the muscles, but basically help promote like that nice good blood flow and good exercise. And lastly, another intervention that we can do would be stress management. Having this condition, again, could be triggered by stress, and again, it's going to be hard for you to be having like a chronic condition, living with that kind of condition. So dealing with your stress is imperative in order for you to manage this kind of condition, right? So we could teach these patients the deep breathing techniques, deep breathing exercises. You know what I mean? It's really good for like managing pain as well. They could also practice yoga, which is a really good way of promoting flexibility on that, and it's also a really good way of like trying to relax. A lot of like postures and movements done for yoga can help stretch out the lower back, strengthen out the arms, the core, that kind of thing, to help with the pain. And lastly, again, there's like meditation techniques. Just trying to find a nice, good, quiet room. Trying to find your special zone, you know what I mean? In order for you not to think about it. And that's the thing with people with fibromyalgia. They're going to experience this for a long time. They have to learn to live with the condition. They have to understand to try to be as stress-free as possible. Okay, and there you have it. That is another video of us, or rather me, trying to explain things and give you an idea of what fibromyalgia is in a nutshell. So I hope that you guys enjoyed the video as much as I enjoyed recording this. I get to play with my little action figures as I do this, and I want to thank Mary Jane and good old Spiny here for entertaining me while I do this video. So as I always say, please be kind and be safe, and you try to be aware of the surroundings right there. And again, we're still in orange while I'm recording this, and hopefully we get to yellow. So there you go. This is Deneb signing off.